Good morning, everyone. Good afternoon, according to your time zone. So welcome to our first webinar called Building Communities of Practice in Education under the DARE RC series of webinars. Basically, just introducing DARE RC. DARE RC is a project funded by FCTO. It is an education research project implemented by the Oxford Policy Management in Islamabad, which is the head office is in the UK, and it's basically operating in collaboration with Aga Khan University and Site Savers in Pakistan. It is dedicated to enhancing Pakistan's education system through high quality research and promoting evidence-based policy making. I'm Dr. Sahar Shah. I'm the Senior Research Manager working with DARE RC, and I'll be your moderator today. So today's webinar is titled From Evidence to Scale, Rethinking Education Reform in Pakistan. The slides are visible, hopefully. Scaling educational interventions, just telling you a bit about the topic, that truly work. Scaling educational interventions that truly work is a pressing challenge globally, particularly in Pakistan, where over 26 million children remain out of school. This webinar will highlight the findings from a DARE RC scoping review on scalable education interventions in Pakistan, conducted by the Real Center at the University of Cambridge. And we are today joined by two really exceptional researchers who I'll just introduce in a bit. And a bit of protocol for this webinar is that you have a Q&A box, and that has been activated for you to type in your questions as we go along. However, we'll come to address those questions towards the latter half of the webinar. We'll be publishing certain questions and we'll address them. We'll try to address all of them, but due to time constraint, we might not be able to address all the questions. Now, good morning, Pauline, Dr. Pauline Rose. Professor Rose is the director at the Real Center at the University of Cambridge. Real standing for Research for Equitable Access and Learning. She is a globally respected voice in education reform who leads cutting-edge research on tackling injustice in and through education. So we're really happy to have her online with us today. And we have Dr. Laraib Niaz. Good morning to Dr. Laraib Niaz, who is both of them in the UK and at Cambridge present. And Dr. Niaz is a postdoctoral researcher at the Real Center. She is a leading voice in inclusive education and brings global insights on gender, disability, and religion in schooling. So welcome to both of you. We can now immediately start talking about your very interesting scoping review on scalable educations all right. Okay, so Dr. Niaz, if you could basically give us an overview, the motivation behind this report, what questions were you trying to answer when developing this report, and how does the incorporation of GESI, gender equity and social inclusion, influence the research? Over to you.
Thank you so much, Sahar, for such a wonderful introduction, and we're very happy to be here. Initially, when we were thinking about this report, the idea was to look into interventions, educational interventions in Pakistan that had the potential to scale or had already scaled. But the idea and the work evolved when we were doing the research. So initially it started off as a scoping review of what are these interventions, what available information is there on the interventions, how they've worked, how they've not worked. But when we started doing the research, we did secondary documentation review. And one thing that came out was that there wasn't enough data and evidence on what kind of interventions had scaled in Pakistan, educational interventions. And so we started speaking to a lot of stakeholders as well. So we had interviews with project implementers, we had interviews with experts in the field who had a lot of knowledge about what kinds of interventions were working. So when we did that, the scope of the research evolved, and we started looking a lot into what are the enablers and barriers to successfully scaling education interventions in Pakistan. And here, by scaling, we refer to institutional embedding and sustainability. This is not only the globally recognized definition, but it's also something that is very pivotal to the case of Pakistan, because in embedding in the scaling in this case means something that is being taken up either by the government or taken up at an institution level and then gets scaled. So then eventually when we were doing the research, we created a framework as well as a checklist also, in which we focused on what are the factors that need to be taken into account for scaling education interventions in Pakistan. And in this sense, this report kind of became a blueprint for a checklist for and a good document for prospective policymakers, implementers, on how to pitch and how to scale education interventions in Pakistan. As far as Jesse is concerned, a lot of my work with Pauline and Professor Pauline Rose actually does a lot of work on gender and social inclusion. And we're also gender and social inclusion advisors for the What Works Hub for Global Education. So all of our work always has a big element of Jesse. So when we were doing this research, we wanted to make sure that we're not just talking about education interventions that overall focus on learning and access, but that we also focus on the fact that these interventions need to have a component of and need to make sure that they reach the most marginalized. A lot of our work does focus on how scaling can be achieved while reaching the most marginalized children, and scaling can be achieved in tandem with equity. Just to give a definition for those who may not be familiar with the term of Jesse, Jesse basically is a concept that examines unequal power relations between different social groups. It is an approach that focuses on rebalancing power relations and ensuring that there are equal rights, opportunities, and respect for all individuals, and that is irrespective of their social identity. So the Jesse lens became an important component of the way we looked at reviewed education interventions and way we reviewed what are the barriers and enablers for these education interventions.
Thank you so much for that overview. That's excellent. So your paper highlights both enabling and inhibiting factors to scale. Can you walk us through how these elements either support or block the scaling of interventions in Pakistan?
Yeah, thank you. Could I ask you to please go to the next slide as well so people can see what these
Yes.
enablers and barriers are? So when we did start reviewing project documentation and we started speaking to the stakeholders, there were these 5 particular factors that were highlighted by all stakeholders, and that's something that we found out through the project documentation review as well. And it's interesting because all of these factors can act as both enablers and inhibitors for the scaling of education interventions. The most important out of all of these elements definitely came out to be political will and bureaucracy. So across all stakeholders who we spoke to, they emphasized how scaling of education interventions, and by that we mean sustainability in embedding of the interventions in the institutions in the larger framework of the government, happens when you have the support of the political elites, of the bureaucracy. That means that having the support of the political party in power, the politicians in power, but also having the support of the bureaucrats, which means the education secretary. Now, having that support is an enabler, but not having that support acts as a barrier. And then there is also the element of what kind of interventions are then promoted. So there was this very interesting example given by one of the stakeholders who spoke about how one of the chief ministers, who I will not name, had a particular package of money that could be used for interventions. And that chief minister said that actually the intervention that I want to focus on is the distribution of milk packets in 3 districts in Punjab. 6 billion rupees was spent on this intervention, and the chief minister would then post pictures with the milk packet in hand and showing that we're distributing these milk packets to students because this will really help their learning. Now this came about without any evidence or data related to this, and this came about also without any plan on how this could be sustainable, how could this be sustained in the long term, and what was the financial implications of it. But this was something that the chief minister was particularly interested in. Similarly, one problem that comes with this focus, this imperative nature of having the support of the political elites is that when there is a change in governance, so there is a change in the political parties or there is a change in the bureaucracy, then that the interventions are impacted. So another example is that in 2013, when the PMLN government was in power and Shehbaz Sharif was the chief minister, there was a lot of focus on public-private partnerships. But then the government changed and the focus lessened. But then the government changed again, and now we see that the public school reorganization program has gained traction again, and there has been an increase in the number of public-private partnerships. So the problem with why it can act as a barrier is because with changing powers and with changing bureaucracy, that can have an impact on the sustainability and on the scaling of particular education interventions. Also because certain political parties would then see some interventions be linked to the other political party. And that means that even if it's working well, you wouldn't want to continue with it because it has the tag of the other political party. Related to this, stakeholders also spoke about how much bureaucracy and red tape there is in terms of actual scaling and embedding of education interventions in the government systems. So political will overall came out as a huge factor. Everyone spoke about how it's important to have the support and have alignment with the government incentives. The second factor that really came into play was human resources and expertise. A lot of stakeholders spoke about how a lot of interventions are funded by donors, but when the donors leave, and there is a certain time period in which these interventions are implemented. When the donors leave, they take the expertise with them, which means that there is a problem in sustaining those interventions within the country. So successful interventions were those which had people and expertise on the ground. An example of this was TCF's Rehbar program. Although we didn't include TCF as an overall intervention because it's not, but we did include a certain intervention that came under TCF's umbrella, which was the Rehbar program, which is a mentorship program. Now, how this was able to sustain was because this was a very self-sustaining model in which there were these volunteers who were trained as the mentors, and then they would train other volunteers as the mentors. It became a self-sustaining cycle, and there was a lot of expertise on the ground, which helped the program to sustain. There were a couple of other examples also that are available in the report of expertise being there on the ground. So for instance, KP's Girls Community Schools had a whole cadre of trained female teachers, and that expertise on the ground helped in sustaining the model to some extent, even though the model still had its problems, but there was expertise on the ground. Another more very important factor was definitely cost effectiveness and equity. And I'll speak later more about equity as well, but there seemed to be a kind of conflict between equity and cost considerations, where the idea was that those interventions that would reach the most marginalized would cost more. Cost effectiveness in particular was a big factor that had an important role to play when considering scaling of education intervention. So there are examples of quite a few interventions that did not scale because they were not cost effective. So one example of this is the climate resilient classrooms under PESP2, which could not scale because of the high infrastructure cost. Another example is the school improvement framework in Punjab, which had a list of around 24 indicators, but the cost was so high that eventually it was unable to sustain. The interventions that did sustain were those which were particularly cost effective. And again, that does not mean that there are costly interventions that cannot scale at all, but it really depends on what cost effectiveness estimates you have, what value for money indicators you have, and what is the kind of data that you're presenting to the government. Which brings us to our fourth point, which is data monitoring and evaluation. So one thing that we did find was there was a lack of effective evaluation and monitoring data on interventions and what kind of interventions are working, what kind of interventions are not working. And those that were able to scale, or those that the government did show some interest in, were those where there was effective data available. And Stride is an example of that, which is an intervention that, again, I'll speak about later as well, but it was an intervention implemented by ISAPS. And they had a lot of robust data on what aspects of the intervention was working, what was not working, and they were able to pitch that data to the government. Finally, another important factor was the alignment of the agendas of the government and of the donors. Donors obviously play a very important role in the education landscape in Pakistan, as do the government. So the interventions that were likely to be scaled were those where there was a there was a parallel and there was a synergy in the agendas of the government and of the donors. An example of this is the reading hour, which was implemented in the federal capital territory, Islamabad. And an interesting part about interesting fact about the reading hour was that it was being pitched and it was being promoted and it was being supported by multiple stakeholders, including the education sector. He was very interested in it, but as well as there was a lot of support and a lot of awareness by a lot of international organizations around it as well. So the World Bank was really pitching it, UN was really pitching it, and there seemed to be a coherence around the need for this intervention. And because the education sector was so personally motivated in supporting this intervention as well, it just aligned all of the donor agendas and all of the um, motivations aligned. Another example of this is the Teach Classroom Observation Tool in Punjab, which again is not an intervention per se, but was a part of PESP too, and was promoted. At that point, there was a lot of debate around this need for observation of teaching in classrooms. And that's when the classroom observation tool was pitched and it was taken up by the government, and there was a system level reform. So it really depends on what kind of donor and government agendas are in place and how well they align with each other. There are a lot of more examples in the report, but in the interest of time, I'll stop here.
No, that's great, actually. A lot of valuable information. The report stresses that gender, disability, and inclusion considerations are often left out while scaling. Why do you think this is the case? And how can we push for a shift in this mindset, particularly in this context? And I'll just change the slide as well.
Thank you for this, Sahar. I do want to add here that in this case, it's not like Pakistan is an outlier where these conversations are happening. These are conversations, especially with funding cuts all around the world, that are happening all around the world. There is a debate around, there are conversations around, there are funding cuts. So should we reach the most marginalized? Is reaching the most marginalized and, equity considerations more expensive? So it's not just happening in the case of Pakistan, it's happening all over the world, because there is this idea, perhaps, that reaching the most marginalized will not lead to value for money. So over here, there is some research that Professor Pauline, Dr. Munazza, Dr. Shanila Rawal, and I have done on the trade-offs between scaling and reaching the most marginalized. And we use evidence from the Girls Education Challenge, which is a whole consortium of projects and interventions that have been funded by the FCDO. It recently concluded. And the Girls Education Challenge basically showed that it is possible to reach the most marginalized girls and still have value for money. So in the case of Pakistan, it is not like the government was actively saying that we do not want to invest in or promote interventions that have a Jesse angle to it or have equity considerations in mind. It's not like they were actively against it. It was just that sometimes it was not a consideration. Sometimes the considerations just were, okay, is this intervention cost effective? And so the problem here is not the government's incentives. The problem here is how you're pitching your intervention. So our idea is that you should be reframing the issue, and stakeholders should be focusing on reaching the most marginalized as a policy choice, accepting that costs are a part of it and not viewing them as trade-offs, because they do provide value for money. And there's a lot of evidence on how there is value for money in reaching the most marginalized. And when you're pitching the interventions, the intervention in themselves, in their design, need to have a built-in Jesse angle, rather than as an afterthought. Because again, when we spoke to the stakeholders, and we spoke to some government stakeholders as well, it's not like they said that actually we do not want interventions that focus on DESI. It's just that sometimes the idea is that there might be a trade-off in terms of cost. And the second is that it's not something they're actively thinking about. What's the solution for that? You actively think about it. You actively involve it, include it in your interventions, in the design of your interventions, in the way you're collecting data, in the way your teams are composed. So yeah. So it's again, And another
Makes
point
sense.
also was that a lot of donor-led interventions did have equity considerations there in the interventions, and then the government would take them up. So it's again, it's not that there is no motivation. It's just that the interventions need to be pitched in a way where Jesse is central.
That's very helpful and insightful. So, if you could discuss the real world examples and discuss which interventions have been scaled successfully and what made them work, maybe you can share insights from Stride or the foundational literacy and numeracy camps. Um, that would be great.
Okay. I think I'll definitely speak about Stride. It is the one intervention I think that has been repeatedly mentioned in our report. It's also because it's a good example of a pilot to scale intervention. I did not mention before, but for those listening, there are three different types of interventions and reforms that we looked at in the report. These included pilot to scale interventions. These are pilot interventions that were pitched by either international organizations, local think tanks, local organizations, and then were scaled up by the government. The second are government interventions that were designed for scale from the outset. And the third are system level reforms. These were often the ones that came under huge programs such as PESP2 or KESP2 and included system-wide reforms such as independent monitoring units, district delivery units in KP. So there are three different types of reforms that we were essentially looking at. Out of those, we particularly focused on Stride because Stride is an example of a local organization pitching an intervention and then that being taken up by multiple governments. So Stride essentially was a pilot program that was designed to address the barriers that prevent children from transitioning to and completing secondary education. It was initially piloted in 2017 by ISAPS, and it was funded by FCDO. It targeted around 180 schools in Bahawalpur and in Muzaffargarh, and it had four building blocks. One was local and targeted planning, second was school upgradation, transport for students, and community mobilization. So it had a lot of afternoon classes and used existing infrastructure for afternoon schools. It was then taken up by late 2018 by the government of Punjab, and they incorporated Stride into the larger Insaf afternoon school program, and they scaled the model to 20 districts. The same happened in KP. It was taken up by the KP government as well, and there was a lot of interest shown in it. And I think as the yeah it was also scaled in KP government. We don't know the exact figures of how many schools are there in how many schools has it been scaled up to in KP, but we know that it has been scaled up by both governments. Now, why was that the case? And we had a lot of in-depth discussions with people running the intervention and just to try to find out what makes Stride different. Why was it scaled up? And the enabling factors that I spoke about previously all come into play when it comes to Stride. So that's why I feel it's a good example. Number one, there was buy-in from the government from the very start. So when Stride was initially being proposed, it was being planned. It was at that point that government stakeholders were engaged. They were being informed about, this is a program that is being funded by FCDO. This is what we're going to be doing. And their interest, there was interest right from the start because there were negotiations and there were conversations right from the start. So there was the government buy-in. Second was there was expertise in the field. Stride did not have, even though it was funded by FCDO, it was being implemented and run by a local organization, which is ISAPS. ISAPS had expertise on the ground, people on the ground who knew who were trained and knew what they were doing. So even after the FCDO left and FCDO was not funding it, ISAPS still had people and expertise on the ground and people that they could then train. So that is something that they effectively pitched to the government. Third was cost effectiveness. Cost effectiveness also because Stride was using already existing infrastructure, already existing school buildings, and then they would have afternoon schools. There were some components of Stride that were not taken up by the Punjab government. And if I'm not wrong, I think the transport facility is one of them, because that would have implied more costs. But the cost effective part of it would definitely was the afternoon schools and school upgradation, but that used already existing infrastructure. So they had these cost estimates with them, and they showed, and they had the value for money estimates with them, and they showed that model to the government that this is what we're using. We're using already existing infrastructure, and very important, they had very robust monitoring and evaluation data. So they showed forecasts and they showed the data to the government that this is how much saving you will have. These are the schools that we'll be using. This is what these are the number of children that would be accessing the schools. They would be benefiting from the schools, and this is the data that we have, and this is the the savings that you will do. So there was all of these factors combined, all of these enabling factors were there for Stride for it to be able to be scaled up effectively. And it's something that this kind of advocacy was something they did both with the Punjab government and with the KP government. And I call it advocacy is because that's what you essentially need. If you want to be working with the government and you want something to be scaled up and taken up by the government, that you need advocacy right from the start. Even if you're not taking government funding from the start, you still need to align with their incentives and have them, in the loop. It's effectively speak to them right from the beginning and let them know of, okay, so this is what is happening, this is the cost saving that will happen, this is the data that we will have. Because they had that kind of interaction with the government, Stride was effectively able to scale.
Perfect. That's very informative. Thank you for that. So if we look at the other side, of course, some enabling factors would also be inhibiting factors, but what are the common pitfalls or barriers that prevent interventions from moving beyond the pilot stages? If you could also focus on that. Yeah.
So basically, with this report, we've also created a list of interventions that have the potential to scale, those that have already scaled, and very interestingly, those that were scaled initially but then were discontinued. I'm not just going to be talking about teleschool and Talim Ghar here, but a couple of other interventions as well that discontinued, which I thought was very interesting because it really shows you the pitfalls, and it helps you understand what are the barriers and what should prospective implementers and policymakers avoid. So as far as teleschool and Talim Ghar is concerned, they were both, the teleschool was implemented by the federal government, Talim Ghar was implemented by the Punjab government during lockdown, and teleschool was, as the name suggests, used television as a medium for learning, and Talim Ghar used both television. There was an app, and there was also YouTube, so learning through that. Why did it not continue? Multiple factors, most important of which was the high operational costs. And this is something that also came about from our conversations with stakeholders, that because it was so cost intensive, because television broadcasting time is expensive, the content development required significant funding, and because after post-COVID, with other mediums of learning being open, this became financially unsustainable, which also leads us to think about long-term planning when they were initially, and I understand that this was done under COVID. So what kind of planning can you do when you know that the world is so volatile? But there wasn't financial sustainability planning from the beginning. Then there was limited reach and access because not everyone has access to TVs, electricity, internet, a mobile phone. So Talim Ghar's uh, later shift to mobile apps excluded children without smartphones or data packages. There was low teacher involvement. Teachers were not systematically trained or integrated into the use of these platforms. Very importantly, there was weak monitoring and evaluation. There are a couple of reports by the World Bank on their effectiveness and evaluating teleschool and Talim Ghar. But other than that, there was no robust data and monitoring available on how these interventions were effectively performing. Then there was digital fatigue, and then fragmented coordination. So they were not integrated into a national digital learning policy, which is also a problem that takes place when certain interventions are not scaled, because they do not become part of the wider infrastructure, wider education landscape, and that needs to happen through policies. Other than Teleschool and Talimkar, I'd previously mentioned that the school improvement framework, that's something that did not scale, the climate resilient classrooms. There were certain interventions under the Pakistan Reading Project, and those were quite expensive, and those were also not um, sustained and not scaled, or they were discontinued. They were initially scaled, but they were discontinued. And one factor that is common in all of these is the high costs.
Makes perfect sense. So in this report, you've developed a framework adapted from the What Works Hub. Could you briefly explain its 4 stages and how it incorporates equity and sustainability into planning for scale? Yeah.
Yeah, thank you. So it's been so this framework was adapted from, and this other framework that we've been working on for What Works Are for Global Education, that looks at why certain interventions scale and do not scale. But I do want to add that this framework is also very Pakistan specific as well. It does have, if it can be adapted, and it does obviously can relate to, What Works Hub as well and other global frameworks, but it is also very Pakistan specific in the way, because there is such a focus on obtaining the government involvement and buy-in from the start, which was something that I felt that was so heavily mentioned in the case of Pakistan. And again, it's something that's there for What Works Hub as well, but I felt it was very prominent in the case of Pakistan. So this framework essentially contains all of the enablers and barriers that I've previously spoken about. And using those enablers and barriers, we've created a framework that gives more of a practical guideline to prospective policymakers and implementers on how do you embed and scale education interventions while incorporating Jesse. I will later talk about the more practical way of doing this as well, because we've also created a checklist and how to go about that. But this framework in particular focuses on 4 different aspects. Number 1 is obtaining government involvement and buy-in from the start, which means that you can tailor your advocacy to established needs. That does not mean that there is a need that there is no interest in, and you do not focus on that. Equity is an example of that. Reaching marginalized children is an example of that. By saying that that tailoring advocacy is important, we are not saying that that means that you only focus on interventions or only create interventions that government is showing a legitimate interest in. So for instance, milk packets. No, that does not mean that you need to do that. You can also create interest through advocacy, through awareness, but you just tailor advocacy to the existing needs, and then you can develop from there. Constant consultations with the government. This is again something that we saw in the case of Stride, where there were constant consultations with the government right from the very start, and obtaining that buy-in from the government is a very important part of this framework. This also means that you should align with donor incentives, government incentives, and try to get that buy-in, get that interest right from the start. The second aspect of it is building capacity in systems right in the beginning, which means having human expertise, local expertise right from the beginning, and very importantly, including a non-salary budget. So a lot of stakeholders that we spoke to spoke about how a lot of financial issues with interventions come in when there isn't a non-salary budget associated with the project funding and costs. Having that non-salary budget can then help with building the capacity and systems right in the beginning. The third aspect is cost effectiveness and adaptability, which means you demonstrate value for money. And again, an intervention can have a very high cost, but still have value for money, because of the benefits that are accruing because of the intervention. So there is a way of using data to show that, yes, it may be a high cost intervention, but it has value for money. And doing that right from the start, and doing that with stakeholders, with government stakeholders in particular, is is a very important way of embedding and scaling interventions. There was some stakeholders did speak about how you can, in the beginning at least, try to leverage alternative forms of funding. So the education foundations come into mind. So for instance, the Sindh Education Foundation, the Punjab Education Foundation, and try to find that alternative forms of funding where they do come under the government umbrella, but not quite as such. And so they can provide an alternative form. And you can do that in the beginning, and then when you have data and evidence, you can show how you can pitch it to the government and then scale it further. And the final is implementation science driven decision making. Implementation science is this process through which evidence, it's a cyclical process in which research and evidence informs interventions, and research on how the interventions are doing further informs evidence. So it's a cyclical process where interventions are ever evolving based on research. So an implementation science driven approach, which focuses on robust data, learning, and monitoring and evaluation, can help bring evidence to policymakers, and then having those built-in monitoring mechanisms and evaluation mechanisms can help embed and scale interventions. All of this while keeping into mind that GESI, gender and social inclusion, having components of GESI reaching the most marginalized is an important part, is an imperative part of scaling. Scaling means embedding and sustaining, and that cannot be seen without having gender and social inclusion.
That's a fantastic framework for scalability. Thank you so much for explaining this. So how can implementers, especially those with limited resources, practically use this framework? Maybe you could share the key early steps they should take, and also displaying the checklist. Yeah.
I do want to add that the checklist is actually quite long, and I wasn't able to fit all of that in this one slide. So this might not look. I mean, you need to read the report to see the entire checklist. Our checklist
we're going to share the link to the report as well. Yes, definitely.
And obviously, this is open to adaptation. The checklist, the list of interventions that we have, they're open to adaptations. So our checklist has 5 different areas. They're similar to what the framework has. We see the checklist as a sort of practical implementation of the framework. So framework is more theoretical and our checklist is more practical. It gives insights into, okay, what can you actually do? It has 5 different components, which involve government involvement and policy alignment, capacity building and institutional strengthening, cost effectiveness and financial sustainability, evidence-driven and adaptive scaling, and very important, embedding gender and social inclusion. I have spoken a lot about government involvement, capacity building, like having non-salary budgets, early government buy-in, policy alignment, addressing bureaucratic and political incentives. But over here, I think I would like to focus a little bit on how to embed gender equality and social inclusion. So Pauline and I have worked on this. We have adapted a framework that was used by WHO, and we've created a GESI assessment framework for the What Works Hub, and it's something that we're using elsewhere as well. That GESI assessment framework focuses on 5 different components of an intervention and can be used practically to guide the design of interventions and making sure that they are addressing gender and social inclusion. So it has 5 different components. One is that having GESI in the design of an intervention, having GESI in data collection, having GESI in interactions with and engagement with community members and other stakeholders, having GESI in team composition, and having GESI in data dissemination. So all of these together can help in embedding gender and social inclusion. So how? For instance, if you have data, then you disaggregate data at a very minimum according to GESI variables. So gender, disability, rurality, poverty, all of the different kinds of social inclusion variable, you at least need to have data that shows the effects of different interventions on those variables. So if there are learning outcomes, then the learning outcomes need to be disaggregated by the GESI variables. Having GESI in the design of the interventions, which means that addressing power relations through your interventions, addressing elements of gender and social inclusion, gender dynamics, other social inclusion dynamics within your intervention, having GESI in your team composition. So making sure that your team is not it is diverse in terms of gender. It is diverse in terms of if your intervention is based in different provinces, that you have representation from different provinces, you have representation from different ethnicities. So making sure that the team composition in itself is GESI diverse, and then having intersectional approaches, making sure that the dissemination of data is considering GESI in mind as well, and there is interactions with and there is engagement with local organizations and local community members that represent marginalized groups as well. Other than that, there are practical guidelines on data, on cost effectiveness, on capacity building, on government involvement. But this is something that maybe we can speak about in the question and answers. And there is the report that will be available, and it will have insights into how exactly the framework can be used through the checklist.
Sorry, just stepping in.
Yes.
Thank you. Just going to say, Laraib, thank you so much. If you can just talk us through the rest of the slides quickly, because I would like to have an opportunity for people to discuss any questions that they might have. Thank you.
Actually, this was the last slide.
Yeah.
Thank you, Dr. Manaz. It was timed that way. Thank you so much.
But maybe to add, Manaza, in relation to what Sahar and Laraib was just saying, Manaza and colleagues have very kindly put in the chat the link to the full report. So while you were speaking, it is there online. Hopefully everybody can access it.
Excellent.
That's
Thank
right.
you so much. Yes, and unfortunately, I mean, much as we're trying, I'm trying to get the chat to be enabled. It's not, so it's in the Q&A section.
So yeah, the Q&A section is actually active, and we have a list of questions already posted there. Thank you so much, Dr. Niaz, for your wonderful insights. So I'll just start reading questions, and let's see, this is where the audience comes in. Yes, Dr. Pauline.
Can I just suggest, in the interest of time, because we've got about 15 minutes, I've been just reviewing the questions, and I think I can just maybe sort of bunch them up a little bit rather than us going through one by one, if you're happy for me to just do
perfect.
that. And Lara, maybe you have a look while I'm speaking and see if I'm probably going to miss some, but I think there's some very good questions there. And in fact, I think some of them Lara might have been answering as you were typing them. So there was one about how we can ensure the sustainability of reforms, particularly ones that are designed by donors in the first instance. And I think that was perhaps typed up before Lara, as Lara was talking about the STRIDE example, which I think was a very good example where that can happen, but we shouldn't take for granted that it can happen. And a very strong message from that is the real importance of evidence and data as well, including cost data, and not, as Lara was saying, not just cost data to suggest that things are cheap or don't cost much, but rather it's about justifying the cost. It's about justifying how much something costs if you're trying to reach particular populations, and why it would be important for this approach at this cost versus another approach at another cost. So that's what we're talking about when we're talking about assessing the cost effectiveness. There was also a point about the fact that, from Bilal, I think that in Pakistan, there's a concern about insufficient data, which I think Laraib also touched on earlier in the presentation. I think, Bilal, one thing you're sort of referring to randomized control trials, which obviously have an important role, but I think there's other types of data that can be important as well. I think it's not necessarily only RCTs that a government needs to have access to, but it's more generally having data and evidence depending on the purpose and approach. But I think that's an important point to highlight. There was also a point from a colleague about, from Sadaf, I think, on the issues around teacher well-being and thinking about their role as things are scaled up. I think really important to think of the teachers as well as the students themselves, who are at the forefront of all these reforms, who it sometimes can feel like it's imposed on them rather than they're part of the process. So really in thinking about how best to involve teachers in the reform process to get their perspectives. They're the ones that understand best what is important, what is feasible. And that perhaps links to some extent with a point on the issue around psychosocial reforms. If I understood the comment from Shiza correctly, I think really important point about, we need to be thinking about reforms to support psychosocial factors and well-being, which it suggested, I think, in the comment, sort of less widespread, and how we best do that. And I think that's more a question of how we address those sorts of reforms and can achieve them. But Laraib, I'm not sure whether the Citizens Foundation, for example, has included those as part of their reforms, or others of the projects that were reviewed, if there are examples. So I've tried to address most of those that I'd read before we started the Q&A, but we'll come back to others. Over to you, Laraib, if you've got anything to add there.
Yeah, I was going to add that TCF actually does include certain interventions that focus on psychosocial factors and how that shapes learning. And REBER also, to some extent, because the mentoring also includes psychosocial support to some extent. So REBER also does do that. I have also something to say about the monitoring and data. That's a very good point that Bilal has made. And yes, robust monitoring and evaluation data is definitely an issue, especially. But stakeholders also spoke interestingly about the fact that in terms of data for pitching interventions, when you're doing your background research on interventions, there is actually data that is being collected in Pakistan by different institutions and different government departments. So it's not like the data is not there. There is data. It just does not speak to each other. So for instance, there are multiple forms of learning. There are multiple data on access, and multiple departments and multiple agencies are doing it, but they're not comprehensive and they're not cohesive and coming together. So that is also one issue within generally within Pakistan as well, and maybe efforts need to be made in making those the data that is already available more systematic, centralized, cohesive, which was an issue. I'm trying to quickly look at the questions and see if we missed anything.
Let me just,
Pauline,
while you're doing that, Laraib, come back in, if that's okay. I think there's 3 questions which interestingly are all related to politics, which I think was actually very much at the heart of our report and became even more important as we were working on it. You can't look at issues around scaling in purely technical terms, and I think that was one of the things we were very keen on highlighting, because we can see in a lot of the debates around scaling that they can become quite technical discussions. And even when we started working on this report, and as you remember, our discussions about, should we focus on going from pilot to scale, and we discussed how that wasn't the only lens that we should be looking at scaling. It's not sort of just about starting with a pilot and seeing whether technically that pilot works and then seeing how to scale it. There's needs to be thinking of the different pathways. So I think these questions on the politics of the process are really important to highlight, not necessarily to say we have all the answers. Javid, in relation to your comment on the not underestimating political will, which is absolutely right. I think in the paper we sort of highlight issues around where there can be concerns about it being done at a very individual level. So between whether it's an external person with a one particular senior person in government, and then that senior person in government changes, and then there's not continuity. And again, Laraib, I think you picked up on an example on that when you were presenting earlier. So, this can very much vary from country to country, depending on the form of the political settlement, the political reform processes, and so on. And I think there's a couple of our colleagues online who've got a lot of experience looking at these issues around the politics of education reforms, which are important to consider. So that sort of, I think, partly touches on some of those comments that I was reading as you were talking, but let me come back to you, Laraib.
Yeah, I was going to say that actually our report focuses a lot on the the need for political will and how bureaucracy and political will together act as both an enabler and barrier for education interventions. And as I mentioned, that out of all of the factors that we are highlighting, political will is definitely the most important. And I remember I used to say to Pauline when I was doing the interviews that it's so interesting that everyone speaks about how it's the politics, how it's a bureaucrat and how it's the minister. We need their support. Related to that, I see there is a question on Sindh and another question on comparison across the governments. So there wasn't enough data available on or evaluation reports and secondary data available on interventions in Balochistan and even in Sindh. There was more data available on Punjab and KP. When we were conducting our interviews, we tried to have a more representative sample. So we tried to interview people from all 4 provinces, but even then there was a slight tilt towards Punjab and KP because we found more interventions in Punjab and KP. We found more data in Punjab and KP, and we found more partners to speak to. In any follow-up research, we would like to do more of a comparative analysis. Right now, we've not done it. Right now, we've just tried to explore what is happening and what kind of interventions are there. We did speak to a couple of stakeholders in Balochistan and Sindh. With respect to the comment on Sindh, yes, there seem to be a lot of issues with the government education system, but there were a few stakeholders that we spoke to who were talking about the public-private partnerships and schools. And according to them and some of the reports that we'd seen, it was to some extent working well, but had its own share of problems. But there definitely needs to be more data available in Sindh and Balochistan. We did feel that there was a particular lack of data in those 2 provinces. What can enable political will? As we said, when I was explaining the framework as well and the checklist, it is constant advocacy with the government. That means you need to make connections. You need to keep them in the loop. You need to show them data. You need to find connections with and there was a particular word used by one of the stakeholders that you need to have one champion in the government who champions your intervention. So someone who can support it, someone whose ideology is also aligned with yours. So yeah, unfortunately, there is no straight answer for this on how to enable political will, but definitely advocacy, conversations, connections.
Thank you, Laraib. Can I ask maybe just 2 minutes of wrap up, please? I can see there's lots of other questions. If you want to pick and choose from those, I need a little bit of time towards the end just to conclude and sum up and give people an idea of what's happening next. So just 2 minutes of your time or Pauline's to sum up or respond to some of the additional questions.
So Manaz, I think we've probably answered most of them. There's maybe one that's on the why some didn't work. I don't know, Larry, if you want to come back to that one. But Manaz, I also wonder if in your summing up you want to just refer to Farid's one, which is more about some of the other studies that have been done. I suspect you might be doing that anyway. But
yes. Perfect. Thank you so much, Pauline. I think that's brilliant. We've taken a lot of your time and Laraib's in presenting and coming up with this. I'm sorry, I was facing tech difficulties and I was not able to really join at the very beginning. And this was supposed to be something I said. My name is Manaza Aslam. I'm really, really happy to see such a brilliant turnout. I am directing the DARE RC research program, and I'm delighted by the engagement that we've been having with so many questions and comments and such a engaged community. And the intention of this webinar actually as a series is exactly that, to create a community of practice, to enable discussions, challenge each other in Pakistan. So I'm really, really grateful to everyone for joining. Thank you so much, Professor Pauline and Dr. Laraib, Niaz, and of course to our amazing moderator, Dr. Sahar, who has also been obviously working really hard to get this set up. I'm really grateful to all the colleagues in Pakistan, in OPM Pakistan, who've been working tirelessly to get this started. This was the first of our series of webinars. And we very much look forward to you joining in for future webinars. We'll be posting them. They will be happening once every couple of months, and we'll be putting them up, advertising them. So please do come along, share with your colleagues. Pauline and Laraib have given like information about something. This was a scoping paper, but as I said, and I posted in the Q&A session, chat, sorry, that there's a link. I encourage you all to go to that website, to click on that link, click on the resources link, and look at what we are doing. Some of the things that you have mentioned are actually forming part of the research that we're already conducting, and your insights and questions will help frame that more. So on that, I think there's not much more for me to add, but just to thank everyone for being here today, for giving us your time, and for getting us started on the very first webinar series for our community of practice. Thank you, everyone. And I think we can end on this amazing note.
Yes, we have.
Sahar, I think you wanted to add something as well.
Thank you so much, Dr. Manaza,
We have
Dr.
a
Pauline,
feedback survey
and
form that
Dr.
you've shared in
Laraib.
the Q&A.
Yes, so has a link been posted on the Q&A box? Just posted right now. So thank you everyone for this remarkable engagement. We do have a Q&A feedback form which we would like you to fill up so we can improve these webinars. So just continuing on what Dr. Manaza is saying, we have our next webinar scheduled in July, on the 23rd of July, and we'll be sharing the details soon. And this report, of course, is available on the DARE-RC website. You can see the website, the resources tab contains the report, and the policy brief is also going to be published soon. I cannot see the link though. Fahad, maybe you can just double check on the Q&A box. Maybe it's in the new latest posts. Okay, perfect. It's there. The link is there. We would love to hear from you. Your feedback would be helpful for us. And thank you so much again to Dr. Laraib, Dr. Pauline, Dr. Manaza for joining us all the way from UK. Good to see all of you. Take care.
Thank you, Sahar. Thank you, everybody.
Everyone. Bye-bye.
Thank you.